This is Ellie, and last week I was asked to speak at a local event to support Bonei Olam, an incredible organization. People have asked me to retell my tale for those who were not present, and that is what this is. I was asked to speak because the journey many couples travel to have a baby with the help of Bonei Olam is one my family can 100% relate to. Not many people talk about infertility, but I hope by sharing my story, others can feel that they are not alone and can feel strength from it. Most people don't appreciate what a husband and wife go through when there's a problem getting pregnant. I'm hoping that by sharing this story, you can learn a small hint of that process. When I first got married 7 years ago at the age of 31, I assumed that since it took me so long to find my husband, that Hashem would have Rahmanas on me and we would get pregnant fairly quickly after we started trying. Unfortunately, that was not the case. Almost immediately, I went to search out the best doctors to see if there was a problem with me or even my husband. At the time, we were living on the Upper West Side, and I went for my consult at Cornell. My husband and I went through a battery of tests, including some very painful procedures. But after all that, it seemed that things were generally good with us. Good news, right? Well, when one is diagnosed with unexplained infertility, they kind of try different protocols and see which one works, which could be a very lengthy process. Step one for me was something called an IUI, an intrauterine insemination. I would be required to come in on day 3 of my cycle, get an ultrasound of my ovaries, and take some blood work. And if all was okay, I could start injecting myself with 2 shots at night, and then come in at 5 a.m. for blood and ultrasound to see how my body was responding. You do this for about 10 to 12 days. Sounds difficult, right? People ask me all the time how I dealt with that. Well, when you and your husband want a family so badly, all of this seems like nothing as long as the end result works. So I patiently waited for my next cycle to come, and we did exactly what we were told. Every night, my husband would inject me with a needle, and if you know me, I physically could inject the needle myself because I am determined, but I wanted my husband to feel a part of the process since we were in it together. Every other morning at 5 a.m., I would go to the office to be one of the first 100 or so women who would come in for daily monitoring so that I could make it to work on time. Once the eggs were the right size, I would have to take a shot at a very specific time to trigger ovulation and be back in the doctor's office exactly 12 hours later for my IUI. You had to be exact in your timing and your dosages throughout the process in order for it to work. I even remember that we were out to dinner with friends in the city, and I set my alarm on my phone. I had the shot in my purse in a cooler, and when the alarm went off, I excused myself to go to the bathroom and injected myself at the Prime Guild bathroom and then went back to dinner. Our first IUI was nerve-wracking. I pinned all my hopes on it working since there really was nothing wrong with us. And the IUI enabled the male sample to be inserted exactly where the egg drops, so they didn't even have to swim very far. The doctor came in to do the procedure and he was wearing a kippah. What a wonderful messenger for such a miracle. He did the procedure, I said my Tehillim, and then I had to do the hardest thing possible. Wait for 2 weeks. The dreaded 2-week wait of trying to distract yourself from the what-ifs, the twinges. Did I feel the embryo implant? Is that my period coming again? It's a terrifying 2 weeks. After those 2 weeks, I came in for blood work at 5 a.m. and had to wait until 2 p.m. to hear from the nurse. I'm sorry, Ellie. It didn't work this time. I didn't understand. We did everything right. Why didn't it work? The doctor explained that they try an IUI 3 times, and if it doesn't work, they move on to IVF. Great, it usually takes 3 times, so it'll happen on one of the next 2 tries. I rationalized it. I didn't even think about IVF because I knew that the IUI would work. So, a couple of days later, I went to the mikveh, and the waters were supposed to purify and rejuvenate me, but all I can think of was that my body had failed me. I sat in the prep room, getting my mind set to have my own moment with Hashem to say, I guess you have a plan for me. I trust you, but please help me. I tried this process twice more, and on the 3rd try, I got the call. You're pregnant. Come back in 2 days so we can check your numbers again. They're supposed to double every 48 hours. I was thrilled. I called my husband, we got excited. It was right around my birthday, and I thought, what a wonderful gift. So I came back 2 days later, and the numbers doubled. And 2 days more, I got a call from my nurse. I'm sorry, Ellie, but your numbers didn't double like we liked. It may be a miscarriage, it might not, but come back again tomorrow. It turned out it was a miscarriage, and I had to take a powerful shot that would force me to wait another 3 months before I could try again. I asked the doctor if we were moving on to IVF. I just wanted to put this behind me and move on. It was my way of coping, but he said, no, it worked. You did get pregnant. It just didn't stick. Let's try again and we'll see. Since I didn't need to see the doctor for 3 months, my husband and I decided we needed a vacation, so we went to Israel. As luck would have it, I would have to go to the mikveh while we were in Eilat. The Eilat mikveh had a non-religious female taxi driver who, out of her own goodness, took women from their hotels to the mikveh. This was the grossest mikveh I had ever been to. The towels were scratchy, there were bugs in the shower, the place was dirty. But the mikveh woman and the taxi driver were angels from heaven. As I was about to immerse, I told her about trying to get pregnant and my recent miscarriage. She gave me a bracha that brought me to tears. It was, and it still is, the most meaningful mikveh experience I have ever had. When we returned to New York, I had my IUI, and 9 months later, my son Jack, Yosef Yaakov, named for my grandfather and my uncle, was born via C-section. After the C-section, I asked my doctor how long I had to wait before trying again. He said with my issues, he would suggest waiting 6 months to heal, then try for 3 months on my own, since I had unexplained infertility, and maybe my body now knew how to get pregnant on my own, and we wouldn't need help. So when Jack was 6 months, we started trying on our own, but my body didn't get it. By now, I was living in Edison, New Jersey, so I wouldn't be able to take a train to the city at 5 a.m., and needed to find a more local facility. At the suggestion of my OBGYN, I called RMA of New Jersey in Somerset and was placed with my doctor. While reading her bio, I saw that she was Indian. I was a little nervous because I was used to Jewish doctors, but I had read her bio and saw that she trained at Cornell while I was there getting pregnant with Jack. That was great. So our first meeting, we went over all of my old records and became true partners in this process. We would go back to doing IUIs. I would wake up at 5:45, now I got a later sleep in, leave my quiet street, and head down to the doctor's office to get my blood and ultrasound, turn around, go home, say goodbye to my husband as he went off for work, and spent the day with my son, Jack. If you know me, I'm a researcher. I leave no stone unturned. During his naps, I read every book on infertility, whether it be Eastern or Western medicine, and would call my doctor to ask, what about this? What about that? I apologize for being the most annoying patient, but she appreciated the questions to challenge and change the protocols. In being my own advocate and failing at 2 more IUIs, we discovered that I had an insulin resistance. Insulin affects estrogen, which affects egg quality. So now, in addition to my shots, I would be taking some more medications. I got pregnant, but lost the baby shortly after. We were about to try for our 3rd IUI when one of my father's friends, who's an OBGYN, said to him, "Isn't your grandson a C-section baby? Maybe your daughter should have her tubes checked again to make sure there was no scarring from her surgery." Well, thank God I have a big mouth and I'm comfortable with my father talking about my fertility problems with his friends. Because as a result of that conversation, I had the procedure done again, which is an extremely painful procedure, but they did find that one of my tubes was blocked. It was wrapped around with scar tissue, which means that the IUI would not work, and IVF was the next step. To allay my fears about IVF, because those 3 letters just seem so huge, my doctor told me that with IVF, they give you the exact same shots that you use with an IUI, but in bigger doses. Everything is the same, except when the eggs look big enough, they put me out under anesthesia to physically remove every single egg that was growing. Then they fertilize it with my husband's sperm. There was another question they wanted to know. For a couple $1,000s, did I want to have the embryos genetically tested? I was 34 by now, and I said, no, I'm still young and healthy. Let's save the money. So we went ahead with regular IVF. On the day of my egg retrieval, they were able to get 32 eggs, and 18 of them fertilized. Now I had to wait 5 days to watch these embryos split, and on the 5th day, they would implant the 2 best in me. Great! I'm sure out of those 18, I'll get a lot. But on day 5, I only had 5 embryos left. I was very disappointed that so few had made it, but still, 5 was better than 1, or even better than none. They put 2 in and froze the rest for another time. I had to wait 7 days for the pregnancy blood work. And when they called, congratulations, you're pregnant. Wow, this is amazing. IVF worked. So I came in 2 days later for my blood work, and it doubled. And I got to the point where they do an ultrasound to see the sac. And it wasn't there. It was another miscarriage. I had asked my doctor what happened, and she said, well, maybe they were abnormal. Maybe your uterine lining is infected. I want to do a biopsy to see if your lining is infected. Great, I like answers. So another procedure, just a biopsy, and my lining, it was infected. So I went on antibiotics, and 2 weeks later, they checked it again. It was still infected. So I then had a procedure to get rid of the affected area. Then we would do a frozen embryo transfer with the frozen embryos we had. Still shots and blood work and monitoring, but no anesthesia. And when they transferred the frozen embryos, it would feel just like an IUI. Great. Been there, done that. My transfer was scheduled for Erev Yom Kippur, and I took it as a sign that it had to work. And it did. My husband and I decided that we didn't care about the blood numbers. We would only get excited when we saw a heartbeat. We had been through too much disappointment. So the day they were to look for the sac, they saw 2. I called my husband and he calmly said, sometimes they both don't stick around, so let's calm down and we'll wait for the heartbeats. And we'll get excited then. So at week 8, we saw 2 heartbeats. And at week 9, we saw them again. And at week 10, I was so excited to go back, but there was only 1. And at week 11, there were none. I didn't understand. How could Hashem give me twins and then take them away? Going to the mikveh after that was really rough. I wanted to tell the mikveh attendant so she could give me a bracha, but I couldn't get the words out. I was so depressed. They did a DNC to see if they could find out if anything was wrong with the babies. That Friday night, I cried over my candles. I just didn't understand. Monday, I got the call that both babies each had a different genetic abnormality, and it was a bracha that I had lost them this early in the game. Now I understood. Every Friday night at the candles, I davened for healthy babies. Hashem had listened. He had a plan. At this point, I said to my husband, I can't do this again. We have to find the money and get the genetic testing for the embryos before they go in, so I'm not going through this roller coaster of emotions. And we did. My cycle didn't start for 2 months because of the miscarriage, so I needed something to occupy my time. I joined an online support group. I went to acupuncture. I changed my diet with a nutritionist. I got every test taken from my blood to make sure that I was clean and healthy. I got a colonoscopy. I got a mammogram. I wanted everything to be perfect. So it was 6 months after my first retrieval with 32 eggs, and I was ready. But now, only 6 months later, I only got 11 eggs. And they were mature, but only 5 fertilized. In just 6 months, my fertility had diminished so. I was really scared. Would I get 1 normal from this batch? Yes, I got 1. So I went for another retrieval the next month, and this time, I got 2 normal embryos. I wanted to do another retrieval so that I would have 4 embryos in total, which would give me 2 chances to get pregnant with IVF, since I would put in, at most, 2 embryos. My doctor said, Ellie, it's time. We need to put something back in. You're getting older. I said, 1 more round, and I read about this other thing that might help my embryos make it to day 5. I know it's really expensive, but this is my last retrieval, so let's go all in. And I promise, I only need 1 more to have 4 normals in total. Then you can put them back in. So we did one more round with this other medicine I read about, my acupuncture, my support group, and I was feeling great. It was unbelievable. I had 11 embryos make it to day 5, and 9 of them were normal. So they quickly put 2 back in, and we waited. I was pregnant. One baby had dug its way in and stuck around. We had even graduated out of the fertility office to the regular OB. When I took my prenatal blood work, I got a call from the doctor. So it seems you have a virus that isn't a problem unless you've never been exposed to it before pregnancy. And because of the blood work you had after your twin miscarriage, it shows that you have never been exposed before. We've never seen such a clear-cut case of someone who contracted this virus for the first time while they were pregnant. So it was a good thing you got tested after the miscarriage, but unfortunately, we now know that there are some risks with this pregnancy. My first reaction was, "Are you kidding me?" And then I settled down and said, maybe this is why Hashem gave me the miscarriage before, so that we could find out that I had never had the virus and we could treat this baby in utero. So I traveled to New York and then Philadelphia. I consulted with doctors in Florida and even in Italy. And I had to sit for 6 hours in a hospital every month taking medications that would hopefully pass through me, through the placenta, and help my baby. We would only know at 26 weeks if the baby was healthy. I was so scared. People would see me around town with my expanding belly and asked if I was expecting. With tears in my eyes, I would say, yes, but. With the prayers of the women in my community and the help of Hashem, the baby did not get the virus and he was born via C-section and was perfect. Gavriel Asher, because without Hashem's help and strength, we would not have been able to do it. I wasn't done yet. Again, I asked my doctor, how long should I wait before trying again? And he said, for me, 6 months. So at 7 months, I went back. I had the procedure to get a fresh lining like I had learned from the last time and took a different shot to make sure my body would not make any eggs since we were focused on the lining for the frozen embryo transfer. My doctor asked if I preferred to put in a specific gender since they knew what they were based on the genetic testing. But I said, I only want the best quality ones put in and don't tell me what they are. So she put them in and we waited. The blood test came back as pregnant. The numbers doubled. The ultrasound showed 2 sacs, but I had been there before. There were 2 heartbeats, but I had been there before. And at the 20-week anatomy scan, it really hit me. Oh my God, it worked. It worked on the first try. I'm actually having twins. Oh my God, I'm having twins. As I was sitting in the hospital getting ready for my scan, I had to fill out some paperwork. One of the questions hit me like a ton of bricks. How many times have you been pregnant? 6 times. How many live births have you had? 2. How many other women have to relive these miscarriages every time they fill out medical forms? Because of the bracha of being pregnant with these twins, I decided I needed to do something to help others, and I decided to start a fertility support group in my town. I put up signs in the mikveh, told the local Tehillim group that was davening for women to have babies, and fortunately, only 6 women responded, and many of them did not want to meet in a group setting. They just wanted to talk to me on the phone. I didn't care, as long as they had someone to talk to. Our husbands are our partners, but sometimes they just don't get it, since they aren't the ones whose body is going through it. In speaking to others, we can learn so much, we can save some time, and we can feel secure. Thank God, 2 weeks before Pesach, my newest miracles arrived. Adela, who's named Fega Fruma, and Nady, whose Hebrew name is Yonatan Simcha. She was named for our grandmothers, and his name means that God gives us happiness, which he did. Bonei Olam is an organization that helps people in every way, whether it's emotional support, financial support, getting appointments with the top doctors in the world, organizing for Shomrim in the lab, yes, Shomrim, who make sure that nothing is wasted and everything that is yours, and financial support for freezing eggs or sperm because of cancer diagnosis, and even helping with adoption, if that is the case. They are amazing. I am glad to have been given to this cause for the past 7 years. It's an emotional roller coaster, it's an expensive proposition, and it's a long process, all of which needs financial and emotional support, and Bonei Olam provides this. 2 years ago, my community raised $5,000 for Bonei Olam. It sounds like a lot, and it is. It covers the medication for an entire cycle of IVF or IUI. And we tried this year to do more. And whatever money we raised was earmarked to go to people in our community for Bonei Olam to help. We want to help have more kids born in our community because of our efforts. And we'd beat that $5,000, and we should all continue to do good things in our communities. Thank you.